Hello, and welcome to Safe and Sound with CCOHS. In today's workplace, we know that prioritizing psychological safety alongside physical safety is part of building a truly healthy and safe workplace. And though psychological safety has been around a while, the way workplaces have approached it has changed a lot over the years. Here to discuss that evolution with us is Mary Ann Baynton. Mary Ann served as co-chair of the Technical Committee for the Canadian Standard on Psychological Health and Safety in the Workplace, was a member of the Mental Health Commission's Workforce Advisory Committee and the Employment Standards Committee, and a director of workplace strategies for mental health. As a consultant, she supports employers, governments, unions, teams, and associations to resolve issues involving mental health, psychological safety, conflict, or performance concerns. Mary Ann, thank you for being our guest today.
It's my pleasure, Ashley.
You've described psychological health and safety as moving from a values-based discussion into operational risk management. What do you think has made organizations start seeing psychosocial hazards as a workplace issue rather than just an HR or wellness concern?
Yeah, it's interesting. I was with the Canadian Mental Health Association back in 2004. And at that time, even talking about workplace mental health, most people didn't know what I was talking about. They thought that I was treating people who had mental illness at work, and that
Oh,
wasn't it
wow.
at all. Yeah. And so that started to change as people started to understand that work can impact our mental health,
Of
that it's
course.
not, well, but back then there was a thing that you brought your mental health to
Right.
work damage, that work didn't do it. It was you.
Hmm.
And now, and even back then, people started to recognize, no, you can take a healthy person and you can make them sick at work. Or you can take somebody who has an illness like depression or anxiety, and you can support someone to stay productive at
Hmm.
work, even while they're experiencing their illness. So as I started to work in this area and started to see that in some workplaces that it was really easy to accommodate somebody with a mental illness. You just
Hmm.
say to the manager, well, take these distractions away and put these checkpoints in place. And they would say, oh, no problem. And they would do it.
Huh.
And then there were places where the chaos, the pressure, the rudeness of people was such that it was really difficult to
Hmm.
tell the people with a diagnosis from the people who were just miserable and negative at work.
Oh, wow.
And I didn't have the language then of psychological health and safety. And in fact, when we started the work on the standard, the working title was a standard for workplace mental health.
Hmm.
And then we said, well, should it be health and safety? Because most standards are health and safety standards, and they put psychological in front of it. Pardon me.
No problem.
Um, Today, I wish that we had gone with psychosocial health and
Hmm.
safety, because I think it makes more sense. But we were worried back then that people wouldn't understand the word
Right.
psychosocial. But that's what it is. We're not looking at people's brains or their mental state. We are looking at the impact of work on them.
The environment. Yeah.
Yeah. So that's what psycho and social is the things in the environment that impact your psychological health and safety. So even from there, Ashley, we went from really this was more an HR issue than anything else,
Hmm.
right? Is
Yeah.
you're to protect employees, you do no harm, and you look at these things and you do it because you want to optimize their performance and productivity. So very self-serving reasons for
Hmm.
organizations to do this. It's not because they're all nice. It's because they saw the value in employees who could really focus and do their work.
Yeah.
But since then, because of what's going on around the world, um, and because of the evolving legislation in Canada around the general duty clause of occupational health and safety being interpreted to implicitly include
Hmm.
psychological harm as well as physical harm, because of human rights legislation, because of labor laws, because of contract laws, employers in Canada are increasingly being held responsible.
Right.
When we look at Australia, for instance, they have a regulation that says employers must assess psychosocial hazards and they must mitigate. So just like we do in occupational health and safety, right? We identify hazards and we either eliminate them or we mitigate them. That is the law in Australia.
Hmm.
So here in Canada, I'm saying to employers, let's get in front of this because it's going to be a scramble if all of a sudden we have that legislation as well. And if you can start to embed it into your existing systems, it's going to be a lot easier than adding a new system on.
Absolutely. So what does it look like in practice if we talk about preparing for some of those regulations? What does it look like in practice for workplaces to identify and address psychosocial hazards in the same way as they have been physical hazards?
Yeah, it's interesting because we just published that work on the workplace strategies for mental health website. And it was folks at CCOHS that helped us with that. They were part of the reviewing team so
Okay.
that we knew that it was both practical and also effective. And so it's really, we need to teach HR and health and safety how to collaborate because
Mhm.
health and safety needs to identify and make recommendations, but then HR has to execute, right? They have
Mm,
to
right.
implement the changes. So it can't be two different groups in isolation. They need to learn to collaborate. HR needs to give health and safety aggregate data so that they can see trends and know where to do those investigations or audits. But it really, I think the biggest challenge is that the many people have told me that the time and the training given to members of health and safety committees in many organizations is ridiculously small or
Mm,
non-existent, right? You do the
yeah.
mandatory training, which is
Yeah.
not at all relevant or customized to your industry. It's just
Yeah.
a general thing.
All new hires do this. Yeah.
And if you don't actually get any time allotted to do it, you're just doing it off the side of your desk and trying to keep your own job on the go. That's problematic to
Mm,
do a good job because what we're hoping is with what we have created is to give the members themselves the information, the tools, some of the forms and the things that they can use to look at the hazards, but a psychosocial hazard,
mhm,
but also some of the things. Here's how you make a recommendation that's not going to be ignored or laughed at,
mhm.
right? That this is just ridiculous. We can't make everybody happy. We can't, always have fun at work. Like, not that I'm saying health and safety people would say that, but
Mhm.
they also may say, well, you need more PPE, which is true. Personal protection equipment can reduce our stress about getting hurt, but is it going to have the effect that is necessary to deal with the hazard, to deal with the
Right.
risk? And
Right.
so we put together some things to say, here's a way to look at it, and
Mhm.
here's a way to make your recommendations to HR, to management, and create a system that actually is going to serve everybody.
Makes sense. Yeah. I think we touched on this a little bit, but what would you say, what are the responsibilities that employers, supervisors, and leaders need to be thinking about now that wouldn't have been on their radar at all 10 or 15 years ago?
um, so I think the biggest thing is that they don't have to be mental health experts because that's what they start to get agitated about. I didn't
Mm.
train to recognize that somebody's got depression or anxiety. I
Not my
trained
department.
as an engineer, right?
Yeah.
And so what I say to them is it's not your job to diagnose or counsel. In fact, it's not even ethical because you're in a power relationship. Your
Hmm.
job is to help every employee optimize their energy, their focus, their competence while they're at work. And what does that mean? That means you need to understand them enough to know what will optimize it.
Hmm.
And so it is, I keep watching what's happening with AI and automation and technology.
Hmm.
And I think more and more the human advantage, the reason that we want humans in the workplace is because of our discernment, because
Hmm.
of our ability to critically think about a situation and the impact that it's going to have on humans, other humans, but also for our ability to be empathic and to read people.
Hmm.
AI is not going to be able to do that. So if this is the kind of complex emotional intelligence that we're going to demand of people, then our leaders need to know how to develop that and how to sustain it.
Hmm.
And I would say right now that probably only about half of the leaders in all organizations really know how to do that.
Hmm.
That's not necessarily their fault. They may not have been trained to
Yeah.
do it. Now, so I think that's the most important thing is to
Hmm.
understand how to develop and sustain the employees' productivity, attention, focus.
Hmm. So, for organizations that still feel unsure about where to begin with psychological health and safety, what kind of realistic first steps can they take to strengthen that at work?
Yeah. So, interestingly, we just released a book called Less Stress, Better Business.
Hmm.
And that's what it is. You have no supports, you have no systems in place. You're just somebody who really wants to do the right thing, but you're so busy and you've got so many demands on your time. So, what do you do? And I say the very starting point is ask your employees what might get in the way
Hmm.
of you doing your best work? What might be an obstacle? What might be a challenge? What could we do? What could I do to make it easier for you to do well at work?
Hmm.
Is pretty simple and
Very
straightforward.
simple. Yeah.
And yet, if you can build that kind of trust and conversation, then that's it. You just respond. Early in my career, I had two employees, both of who had a mental illness and different mental illnesses. And I asked them something similar to that. What do you need? And what we ended up doing was a swap because one was overwhelmed with details, couldn't focus, couldn't um, get there. The other person was really afraid of face-to-face client work. And
Hmm.
all they did was trade parts of their job so they both could succeed. So here's an employer, and I was pretty naive at that time because I was still in my 20s. Here's an employer who asked, and the employee solved my problems for me.
Amazing. Yeah. All you have to do is ask sometimes.
Yeah,
Is there anything else you'd like our audience to know?
so much. But
What
I
would you love
think,
for them to take away from today?
yeah, I think it is that being good at psychological health and safety is not about being perfect. It is not about being nice all the time. It's not about having no stress or no demands at work. It's simply recognizing where the hazards are and managing them in a way that they're less likely to do harm. And
Mhm.
whether you're in health and safety or you're in HR or you're a leader, that's the balance. We're not asking you to do too much if you know how to integrate it into business as usual, what you already do.
Excellent. Well, Mary Ann, thank you so much for joining us today and sharing your expertise.
Thanks, Ashley. It's a pleasure. Looking forward to the conference in October.
Yes, absolutely. Forum. We're looking forward to seeing you there.
Yeah.
For more information on psychological health and safety, visit our website, ccohs.ca. Thanks for listening and stay safe out there.